we find that even in remote and rural hospitals, about 4 to 5% of the patients have urology problems. And unfortunately, in some of the very remote places like the Arohi hospital in the Himalayas, less than 2% of these patients are able to have the necessary treatment. Because even in the Western world, there is a shortage of urologists. And why is it that the non-urologists like general surgeons or others able to do urology work? The primary reason is the cost of the equipment. Even a simple cystoscope, without which the urologists are not able to do any work, costs almost 12 lakh rupees. This is out of the means of most of the rural facilities or hospitals where the turnover is not much. So that is the reason why we from the Rural Surgery Innovations came up this laptop cystoscope. Here all that we did was replace the conventional telescope with the endocan, and it's a plug and play device which attaches to any laptop computer or even the cell phone, and you can start doing procedures. There's no need for the camera, the monitor, the light source, and all the expensive accessories which are necessary for conventional cystoscopies. And then the most important thing is the learning process. Unfortunately, even with the experienced urologists and others doing the cystoscopies, we still have a lot of patients who come up with strictures in the urethra, which are iatrogenic or caused by injuries, which are due to the learning process when we learn on the patients. So that is the reason why we have come up with this model, which mimics exactly the normal tissue. It feels like a normal male urethra, and also it's very flexible and mobile. And now, thanks to the RIMS team, we have a technique to be virtually present in the operating room. With the 360 camera and the monitor views and close views, it's possible to be virtually present in the operating room to learn the correct techniques. So all that you need to do is, so we hold the cystoscope like this, because this is the smooth portion which doesn't enter the frenulum. So we pass it like this and then turn. So if you just look at it normally, you'll see only the transitional epithelium, which is a very fragile tissue. So you need to have the proper look at the lumen, and then slowly, gently, without touching the walls, advance the scope. Now it looks as though there is hardly any lumen. This is because the way we are holding the urethra. So you will notice that now there is hardly any lumen. If you try and force the scope, you will cause injuries. Even a little gentle injury can cause a stricture. So that is the importance of having both the outside view and the monitor view. Because now if you keep looking at the outside view, I am slowly bringing the scope down. So now the lumen is visible quite clearly. And unfortunately, this is the area where the strictures occur frequently. Then you land up in the landmark called verumontanum. It's where the sphincter is. And then either side you can see some prostatic tissues. Then when you further bring down, you can see the bladder neck. Then once you go into the bladder, you can find the ureteric orifices, and you can also practice learning how to do double J stenting, which is a life-saving procedure if there are bilateral ureteric stones. We have had many patients come with acute renal failure because of block due to bilateral ureteric stones. Here we also have a stone and the ureteric orifice on the other side. So this, and again you need to take out the scope in the correct angle. So the big advantage of this is that you can also learn the procedures on simulators which are realistic rather than trying to learn on the patients. So this simulator is a full model which can be used to learn gasless laparoscopic surgeries also. And we also have a smaller, less expensive model on which you can learn the cystoscopies and procedures like DJ stenting or DJ stent removal or biopsies and emergency procedures. So all these are possible with these two simulators where you can learn the skills. And once you learn the skill, you can go directly to the patients and learn from them.